So our bitch is pregnant. Now the owner wants to know when his bitch will be whelping, because he wants to be there. Again, we have some clinical symptoms, but all those symptoms again are not reliable to determine the exact whelping period or whelping time. We have a vaginal discharge a week before whelping. Bitches start up with milk production. There is a drop of body temperature, but all those clinical symptoms are very individual and will reveal no exact information. So we try another way, and we looked for other tools. And one way they was found was starting up from the moment of the LH surge. LH is a hormone produced in the pituitary gland in the brain, and this hormone is responsible for ovulation within the 24, max 48 hours after the production of this hormone. This hormone is produced in a very small period, in a very large amount, so this is really a surge. So what happens, we starting up from the LH surge, and we see when the bitch will be whelping, and we found that 65 days later the bitch will be whelping. The problem in practice is that it's practically impossible to measure LH hormone, because the lab is not able to do. And we found that in practically all bitches, the LH corresponds to a progesterone level of 3 nanogram. So when we have a progesterone level of 3 nanogram, we add 65 days and we have our whelping date. Because we know that 24 till 48 hours later ovulation will occur, so on the progesterone level of 6 nanogram, so we add from that time on 63 days and we have also our whelping date. In theory, because in practice there is too much variation, and for me it's not a good tool to use. A tool that can be used and very helpful and very easy is the use of vaginal smears. What has to be done, we ask to the breeder to take every day a vaginal smear and to put it on a microscopic glass, and to put on that glass also the date of sampling. From the moment this bitch is mated, it still continues a few days, and after the cycle has stopped, he brings all those glasses to his vet. He makes a little coloration, and the only thing the vet has to do is look for white blood cells, like those little structures that you see here. What happens is that after ovulation, the vaginal wall is shrinking again in thickness, and that means that at a certain time white blood cells will be able to pass this vaginal wall. And so we see at a certain time under microscope the appearance of a great amount of white blood cells, really from 0 to a great amount. And when we add 57 days starting from the day we find for the first time those white blood cells, you may be sure for 99% that that will be your whelping date. So it's an easy tool that can be used certainly in bitches with delivery problems or questions. So the highest fertility in bitches lies between 2 and 8 years of age. Bitches continue to cycle till death and continue to be fertile. And that's a problem that we sometimes see in practice when owners has a mated bitch, a bitch from 14 years old, for example, that has been mated because owner thought that cycling and fertility has stopped in the dog. The amount of litters that a bitch can have depends on general health and litter size. when general health of the bitch is normal, she's in good shape, she can have a litter a year without any problems. If a cesarean section has to be performed, and if there was no complication however, or whatever, then I think a bitch can have 4, sometimes even 5 cesareans without complications for the bitch itself. Ethically, it stays the responsibility of the owner to decide when his bitch should be taken out of the breeding program. If contraction of the womb is needed during whelping, the owner can go out for a walk with the bitch for 15 or 20 minutes, because that will stimulate uterine contractions. He also can give a massage of the mammal glands, but the first rule that he has to keep in mind is to be patient. In most of the cases, a spontaneous solution will occur, and if not, drugs as oxytocin has to be used in a proper way, in a correct way. And if things really goes bad, cesarean section has to be performed. So, puppies are born, everybody is happy, we have our puppies, and suddenly one puppy died, and the other ones are starting screaming, they won't eat, they scream, they die, all of them. When we do a checkup of those puppies, in most of the cases there is no answer that is revealed, we find no reason why this thing happened, but sometimes we find in the abdomen of the puppy the presence of infection. This infection is due to contamination of the umbilical cord of the puppy and a contamination that occurred during whelping. Sometimes also we find lesions, typical lesions on the kidneys of those puppies, and those lesions are indicative for the presence of herpes. The occurrence of herpes nowadays is exaggerated, but herpes is an important germ. It gives big problems, or it can give big problems, going from resorption, infertility, abortion, dead-born puppies. Every kind of problem is possible due to herpes. These are 2 puppies born on a natural way. Both, one puppy stillborn and the other puppy died already a few days before. What we can see easily, because we can pull on an easy way a bit of hair and sometimes even a bit of skin. Because a virus like herpes doesn't like high environmental temperature, that's the first thing we have to do in treatment. So we have to increase the environmental temperature up to 40 degrees. So the best thing to do when you try to perform this is to put a thermometer between the puppies so that you don't exaggerate. The reason that we have to increase temperature up to 40 degrees is because also we have weak puppies, and those puppies are not able anymore to stand in for their own body temperature. So we do it artificially. Because the temperature is much too high for the bitch, it's normal that we take the bitch away. Puppies are too weak anyway to suck, so we don't need the bitch at this time. Because the puppies need to be fed, the breeder has to feed them artificially, and he certainly has to be aware that due to the high environmental temperature, the puppies also need fluids, another fluid, so that they don't deshydrate. And a last tool that he can use, but it's really a last tool, it's possible to give those puppies 1 ml of serum directly into the abdomen, so intraperitoneal serum that is being taken from the blood of the bitch, because the bitch has all kind of antibodies in her circulation, and those antibodies are needed by the puppies. Because in the serum are also other proteins present, you only can inject this serum once, because by injecting this serum the puppy will develop an allergic reaction, an allergic reaction that will give a shock reaction and death of the puppy the second time you inject the serum. So you only can use it once. Don't use it too quickly, because this allergic potential reaction stays in the dog for the rest of his life. So from the moment he needs a blood transfusion, it's possible that he will have the same shock reaction and that he will die. So a blood reaction of a blood transfusion will kill him instead of helping him. Having puppies sometimes is a problem, certainly to keep them alive, but having an empty bitch isn't amusing either. So the first thing we think of when a bitch stays empty is we ask us questions about the male. Is the male fertile? Are you certain the male is fertile? Did he produce some litters in the near past? And if we have here a positive answer, we can think about the second reason why a bitch can stay empty. How about the mating? Was she mated on the right time? Are you certain that she was mated on the right time? Did you do a progesterone test, yes or no? Or did you only use some clinical signs? The mating itself, were you present at the time of the mating? Or did you give your bitch away for a few days? And the mating, was it a normal mating? Was the male normally agitated, yes or no? So we can ask us some questions about mating time and type of mating. Then we can think about the presence of infections. There are a lot of subclinical infections that can give infertility or a lower fertility rate in bitches, like the presence of coli of Streptococcus, most intravaginal and intrauterine. So, but those infections are chronic, always chronic, and subclinical. This means the infection is present, but you don't see a thing on your bitch. So you have to look for it, you have to take some samples to clear this thing out. Other infections that can cause fertility problems are viruses like herpes or other viruses. Also, some anatomical disorders like collisions in the vagina can cause some problems in fertility. Collisions also in the oviducts, so that sperm cells are not able to reach the egg cells, are possible reasons for infertility. Also, stress can cause fertility problems, or medication that has been given in the near past. So there are a lot of reasons that has to be checked out why a bitch stays empty. Of course, the willingness of a bitch and the experience of a male is of great importance for having a litter.